Okay, so one of the sounds like the biggest key difference is CoolSculpting destroys the fat cell, which can cause kind of dysmorphia around where the CoolSculpting was done,
That's right.
versus red light, which initially expands the fat cells, the contents leak out, and then ultimately, over a series of sessions, the fat cells shrink. So instead of destroying the fat cells, we're shrinking the fat cells, which leads to reduction of inches
That's
and
right.
ultimately weight loss. But it's also producing collagen and elastin production, which then tightens the skin as the fat cells are getting decreased.
That's right.
Inside, I've got some follow-up questions. So inside CoolSculpting, do you see, because typically when people lose a lot of weight, we'll see sagging skin. How does that look with CoolSculpting?
It does tighten, like with most of the cases I've seen. Those areas, they remain pretty also tight.
Okay.
Mm-hmm.
And then walk me through CoolSculpting versus cryo.
Therapy,
Yeah.
right.
What's the difference?
So cryotherapy, as far as for fat loss and weight loss, the thought behind that is if you cool down the body in extreme temperature, then your body, in order to regulate your temperature, it's almost a thermogenesis type of an effect, which means that we're trying to warm up after we've been exposed to extreme cold, and that in turn should burn fat. And actually there's more research on burning brown fat, but that's the whole idea behind it. So again, we're not getting, just like in CoolSculpting or cryo, you're still not getting that offload. You're not getting that holistic approach in offloading toxins. You're not offloading triglycerides. You're not offloading cholesterol.
Yeah, and I know from doing cold plunges, like you're not going to target a certain area. With cryo,
Right.
it's an overall reduction, and then a hope that an increase in brown fat would increase, which reduces other types of fat. So that's okay. Got it. So very different applications.
Very different.